Welcome to the Sandwich Crunch, where we navigate the trends and issues facing boomers and seniors in home, in the workplace, and the community. We're excited to be here today and have you join us. And I have a lovely guest, Cindy Robinson. She's a long-term care specialist in insurance, and we are going to be talking about long-term care and the reason why we should be consider having it in our life, and especially starting earlier than later.
Right.
And you were just sharing just before we went on, there's an article you just read, so I thought we'd just kick it off with that because that was an astounding number you just shared.
In the Sacramento paper this month, so just a week ago, and it was talking about long-term care, and it gave a lot of resourceful information at the very end, you know, if you want to get more information, but it was the latest. They said that they're estimating for California, the average, if you had to go to a nursing home facility, is $94,000 a year.
A year?
A year. That's average.
That's astounding because right now, isn't it like 70% of those in nursing homes under Medicaid?
There's the majority that are. You're either going to be self-insured, which means that you are you believe that you can financially afford this, and you are taking that risk that you don't need the insurance because this is specifically to protect you against that kind of high cost. So if you don't have this insurance, because your health insurance doesn't cover it, your Medicare does not cover it, for long-term care.
Well, why don't you explain exactly what long-term care is? Because a lot of people, they may have Medicare, they may be on Medicaid, or they may be in transition and getting ready to retire. They may not be 65 yet and are in a position where they're going to have to sign up for Medicare, or they're looking at the long term, where am I going to be? And they may be 50, they may be 40, they may be 60.
Right.
And so what would long-term care insurance do for them?
The younger you are, the lower the premiums are. Yes, you're going to be paying for it longer, but if you take a look at this, average, they're saying that the people that sign up or look into the long-term care is 59, so just before you turn 60, which the price, obviously it's based on your age, but it really does go up after the age of 60. But again, then you're going to be self-insured and you're looking at that type of cost if you don't have this insurance.
And what does long-term care cover, though? I mean, that's what people, I think, don't understand, because a lot of people go into Medicare thinking it covers long-term care.
Right.
Medicaid does in certain ways, but you have to qualify for that.
Right. Take a look at the Medicare book, and it will specifically say custodial care is not covered.
Right.
Skilled care, which means if you're coming from a hospital and you're not well enough to go home, they'll send you to a skilled care facility so that you're out of the hospital and you're in transition. That's a skilled care facility. Medicare will provide protection for you for a short-term period.
Right.
Anything that needs adult daycare, home health care, if you had to go into a nursing home facility, you or assisted living, you have to pay that cost out of your own pocket. So this is specifically having insurance that is to help you against that type of high cost. And people will ask me, well, when do I look into this? And like I just mentioned earlier, the younger you are, the lower the premiums. Yes, you're paying for it for a longer period of time, you can. But if you do take a look at this as you're getting ready as far as your retirement plan or your financial package or your portfolio, take a look at what do I have? What are my assets? Do I have enough then to be self-funding against the odds of going into a facility?
And the odds are high.
They're very high. It's almost 1 out of every 3 will spend some time in their lives in a facility, needing care.
Exactly, whether it's just out of a hospital for maybe an extended period of time, which extends over their Medicare coverage,
Right.
or it may be because they are in a terminal state and they need to be in a place where someone can help them with all of their active daily living issues.
If you were terminal, then hospice would take over, so you got that protection. This is specifically if you fell, you broke your hip, you're on your own. Maybe your family is out of state. You know, we're not the Waltons anymore. We don't,
Right.
you know, everyone's busy. We're called the sandwich generation. You know, you're taking care of your family, you're working, you're taking care of your parents now. There's stress. So it's like, this insurance gives you the independence that you're not burdening your family. You've got your choices available to you, and it's not coming out of your savings and your assets that you worked so hard to build up. And also for the children, it's their inheritance. They're looking at their inheritance that they thought that they were going to get, and there's no more free ride. If you go on the state-funded program, once that person has passed on, then the state will take over whatever they paid to those facilities and get their money back before it goes into the estate.
And the state-funded program is Medicaid.
Right.
Or Medi-Cal.
Medi-Cal.
It depends on
Medi-Cal.
each state. Each state
Right.
has their own
Right.
Medi-Cal, Medicaid program, so they have different.
Right. And to get this information, I mean, you have to you're a licensed agent, and then you go through additional training to be qualified to discuss the long-term care. California and Florida are the two toughest states because we are protecting our seniors, as we should.
Well, I think aren't California and Florida the largest senior populations in the states?
And that's why we have the strictest laws, and we should be protecting them. So you have that additional training, that additional certification to be educated and talk to people regarding these concerns and what are their options. This has been around since the late 70s, early 80s, and I've been involved with it for a long time. The old plans, what you used to get was strictly nursing home. You couldn't have, everyone would say, I don't want to go into a nursing home. I want to stay home. I do not want to go anywhere but my home. My spouse will take care of me. And that's the desire. And that can happen, but then the person, the spouse that is taking care of that loved one, that wears them down. Who's going to take care of them and give them the relief? If you're talking about dead weight, and it's not necessarily that you're old when you need to have this care. Like I said, you could slip, fall, break a hip. You could have had an auto accident.
Yeah, you could be 25-year-olds and need
Absolutely. You could be recovering from a major surgery, and you cannot go home. You're going to need to have some time to recuperate. Or you had a stroke. I mean, a stroke, you could be healthy right now, and tonight you go to bed and you've had a stroke. So to take a look at what is available, and again, back in the 70s, early 80s, there used to be like 20 different companies offering long-term care, okay? They didn't have any actuarials. They had no idea, you know, how, so they looked at life insurance for their actuarials. Well, we're living longer.
Yeah, 30 years longer since the 1900s.
So we're living longer, and we're just barely, some people are able to retire. They go back to work because they can't retire. So the plans now are different than how they used to be. It's like a pool of money. I always say, picture a big pool. And if you stay at home, it's like taking that bucket and just dipping into what you've decided by the advice of somebody talking to you, an agent talking to you, what is best for you. And then if you're at home, you're using up a little bit of that pool of money that is available to you. If you go to a nursing home facility, that's the largest amount of money that's going to come out of that pool of money. But now you have everything. You have adult daycare, you have home health care, you can be in a skilled care facility or a nursing home. So when people say, when do I take a look at this? Like I said, yesterday, because yesterday you already know you did okay and you didn't have a stroke. You know, you're still alive and you don't have any major health problems. It is your health that buys this insurance. It's your money that pays for the premium. I've had people that they would pay anything. They just got diagnosed that they have Alzheimer's. Just found out. And now they know what their reality is. And then they want to get this, and they can't qualify.
Yeah, now that's a very key point, is that there are specific rules with long-term care insurance of where you're disqualified completely. I mean, if you have MS, if you have, is it diabetes, if you have, I mean, isn't there a list of about 20 different types of things that will, there's no way you will get long-term care insurance?
It's some like diabetics, you can. It depends if you're using insulin, if you're, controlled by diet, exercise, a tablet form. But there are some definite flags that you will not be able to get this insurance if you currently have certain conditions.
Well, like MS is one, multiple sclerosis is one.
Right.
I know I looked it up when I was checking this out, and I thought, wow,
Right.
it's kind of disappointing because when you look at these illnesses and many of the chronic illnesses that the boomers and seniors and many of the elders are experiencing, will be denied long-term care insurance because of some of these chronic illnesses. So it sounds to me this needs to be part of your financial planning and your
Portfolio.
estate planning,
Right.
so you can protect your
Right.
estate. Now, I have a question because I've spoken with several people, some that have long-term care insurance, and obviously you do, and then I've spoken with several others who don't. And so when is it that you determine, is it the right move for me to have long-term care insurance, or is it better for me to self-fund what I need to have in my later life? Like maybe put aside, say, an irrevocable annuity or something like that that can help them to pay for what they need for their long-term care.
Good question. And I have people say, I will self-fund. And that's fine as long as you can commit to putting, if it's $94,000 right now here in California a year, that's going to be going up every year. Can you afford to put $100,000 aside? And that's the average. San Francisco, the last time I looked at it, it was $153,000 a year. That's self-funding. That's believing you can put that away, not tap into it for an emergency. It is truly just in case you're self-funding if you need to have this type of protection.
But this is a challenging issue because now you're dealing with, we've got medical care costs that we have to pay, we have auto care insurance, we have homeowners insurance, we have umbrella insurance, we've got all these other insurances. Now we need to add this insurance, and this one has such a variable. I was just reading a statistic that by 2020, they will be expecting us to pay $18,000 to $25,000 a month to be in a nursing facility. I mean, I was flabbergasted.
And absolutely. And so this is why part of this protection, they have what's called an inflation rider. And that inflation rider, you can have it simple, which means it just compounds 5% every year, okay? Or you can get it compound. And I just want to keep this really easy so people can understand it. But as inflation goes up, your plan, your pool that you have decided on, and it's not covering you 100%. You can't. You're going to have to pay something later, but at least it's a big enough pool, hopefully, to give you that type of financial stability when you need it, when you're not working. And again, don't just think about being old. It could be an accident. I know for myself, I'm not going to go into the specifics, but I had a major surgery. I was going to wait until I was 59, like what they're saying, the stats. I don't have longevity on my side of the family. Both my parents are deceased. And my late husband, he was our first client back in the 80s. And I thought, no, I'll wait until I'm 59. I'm healthy, I'm a tomboy, I'm active. Well, I had a major accident on my boat, and after I've gone through a year, so I was 49, then I went ahead and I took a look at getting this insurance when I was 50. And I'm really glad, because then when I had this major surgery at 52, I'm now one of those stats. I'm non-qualified. There's not one company that would touch me. So I have the protection for myself. I'm glad I didn't wait 10 more years, 9 more years to get this. But yeah, so here I am, still active, still busy, but I'm flagged. I'm one of those that cannot, doesn't matter how much money I have, I couldn't get it.
Had you not signed up for it, you wouldn't be able to have it.
Right.
Wow. So what does somebody do when they're looking into a long-term care insurance company? I mean, what should they look for? Because obviously there's all kinds of insurance companies out there, and I'm very familiar with the medical side of it. and understand that, you've got Blue Cross, you have, Blue Shield, you have all these, and now you have the other care systems that are coming into play. And I want to know is, how does someone make an appropriate decision for the right insurance company for them? Because I'm sure they all have different rates. They have different policy selections, I would imagine. So how do they make that decision?
Like I said earlier, before there was about 20 companies, and then they found out, really what the reality is, we're living longer and what the cost is. And so they transferred their book of business to another company. So it's gone from that wide range, 20, down to about 5 companies now.
That's it? Wow. Wow. That's astonishing.
It's a handful. It's a handful of companies. And so really what is available today, there are strong standing companies. Their underwriting guidelines, it's like I have a couple of companies that if I can't get a client covered under one company, then if the underwriting might take them under this other company, but the premiums are going to be higher because they're taking people that are higher risk, unless you're tagged like I am, and nobody's going to take a look at me. So, but it's not just saying if you're diabetic, you cannot get this type of insurance. Some are absolutely will not, and others will keep an open, take a look at an application, take a look at the medical records, and then accept you. Now, once they accept you, they cannot then decline you later, okay?
Well, now that's a good thing to know, because
as you're getting older, and
you don't want them to all of a sudden say, well, too bad, you
Right.
can't get it because you just got that disease and we're not
Right.
going to cover you anymore.
right.
That
I
would
mean,
be
I have a
horrible.
perfect example where in Colorado I had a couple, very active, skiing, tennis, and everything else, and it took almost a year to finally set up the appointment to be with them. Sat down with them, put the application in, and sure enough, they got their coverage. And I called the wife with the good news that, and it takes almost 2 months to get, because they go through the underwriting, they might do a phone interview, they might, depending on your age, and some companies, they want a face-to-face interview.
Do they do a medical, like in a life insurance, do they do a medical preview?
They
type
do.
of thing?
They take
Okay.
a look. Okay. And so when I called the wife to tell her that I have both of their policies, she went, "You're not going to believe this." She said, "My husband was on the tennis court, had a massive stroke, went from the tennis court to the hospital. The stroke is so bad he now cannot come home, and he has to go into a nursing home facility."
Oh my gosh.
And the good news was they had the protection. I had their policies. They signed what's called a conditional receipt, and that just means that if you are accepted by the company from that day past, then you have the protection if they choose to accept you as a client. So when they're going through the underwriting, if anything happens to you and they did accept you, you've got that protection, and that's exactly what happened with this couple.
Oh, were they lucky?
Oh, were they? And so as soon as he got out of the hospital, then you have what's called an elimination period. It's like
Right.
a deductible.
Right,
Like
and that's through Medicare, right?
but for your health insurance, you might have deductibles or anything. But so this is called an elimination period, and that's all it is a deductible. And so you decide how many days are you going to pay out of pocket before the policy starts. And so once he got out of that hospital, he met his elimination period, he had the protection, and back then it used to be what's called lifetime. He had an ongoing protection from the time and they don't offer that anymore because now they're taking a look at realistically
How long we're living.
how long we're living and what is that going to cost. But he had the lifetime plan. So if anybody out there has a plan and it is for lifetime, it's golden. Do not let that lapse. Keep it.
Yeah, I think like CalPERS has those that they started out quite a while ago with a lot of and a few others. So
Right. So it's
hold on to that, baby.
Hold on to it. So now what they've done is like you can get a 1-year plan, you can get a 5-year, and 5 is the max that you can get. But again, so it's just to have that protection. So that particular client, so when do you get this? Yesterday. Take a look at this. This is so important.
It's interesting because I think a lot of people don't understand the ramifications of us growing older. and the statistics that are out there. I mean, one of the statistics I recently read is that by the time we are 85, 50% of us will be diagnosed with either dementia or Alzheimer's. I think, well, I don't want to be here. Just throw me out of a plane. I'm sorry, but just you're looking at very staggering numbers and staggering issues. I mean, when you're talking Alzheimer's, you're talking a horrific way to end a life.
Right.
And
Right.
and when you're in stage 2 or 3 of Alzheimer's, you have to be in a nursing facility because most of the time, unless you have the family ability to take care of a loved one,
Right.
it's almost impossible, and especially with all the dynamics that go along with Alzheimer's, because not every Alzheimer patient is the same. They're all individual.
Right.
But they all have very serious issues that go with it.
And Alzheimer's is not going to kill you. You just don't
No.
remember.
Right. and
Okay,
that's
you go
what's-
back to child.
That stinks. Oh, yuck.
So it's a very important issue. And like I said earlier, 1 out of every 3 will spend some time in their lives needing care.
And it's important
pretty
that you
high.
mentioned that Medicare does not cover this. Now, and a clarification for custodial care is like me taking care of my mom. That's custodial care. Or having someone come into your home that is not a skilled nurse, not a skilled doctor, it's not prescribed by the doctor. That's custodial care. Whereas you're talking skilled nursing is covered by Medicare for a limited period of time, not for what you're talking about for long-term care. But if you reach that number where you need that long-term care, then that's where you step in. Is that right? Is that? Well, I mean, you've got so many days that you've got to be under Medicare coverage, and say someone has reached their lifetime coverage of Medicare days, which a lot of people don't know what that is, but
Right.
I think it's 160 days. I think your total lifetime coverage that they will cover.
Up to. Those
to.
words.
Up to. Nothing after that.
Right.
And so then after that, you're either on your own, or you sure as heck hope you got a great family that can be there for you.
And when you're talking dead weight, I mean, you talked about with your mom, okay? My mom also, I helped assist taking care of her, and still working, married. And when you're talking dead weight, I'm tall. You know, I'm 5'10". She was 5'5", 5'4", petite. But when you're talking dead weight, you know, that is a whole, and toileting, bathing, and a lot of people, that's why this insurance is so important. It gives you that independence. You're choosing not to have your son, your daughter-in-law bathing you, toileting you, you know. And again, it could be an accident. It does not necessarily have to be elderly, you know. So, and the amount of time that it takes to truly take care of somebody that needs 24/7, and who's going to give you the relief?
That's a huge factor for caregivers. I mean, I think there's a statistic that shows that caregivers actually die before the patient does. Oftentimes, there's a very large, I can't remember the exact number, but it's a very large statistic because as caregivers, we want to keep giving, and we're
You wear
afraid to
yourself
leave.
down?
And we wear ourselves down and don't give ourselves self-care, and we give everyone else care, and especially women are the primary caregivers.
And that's the other thing. It's like most of the time, it's the husband, and I don't know what the stat is, but it's the husband that needs to have assistance first, and the wife is there to take care of them and hopefully have family members to assist. But then she's petite, and she is wearing herself down, and when the husband, if he finally does go into a nursing home facility, because she is so worn down, then she could slip, fall, break a hip, and then she's in the facility as well. And that's, again, that's a high stat, but I don't know what the number is offhand. So it is a very important, it's something to this type of insurance. And when you mentioned it earlier, yes, we have our health insurance. You know, we have our homeowners insurance. You know, I think the stat is 1 out of every 1,200 homes have a major fire in their home, and yet we all have homeowners insurance. We have to, by law. Car accident, by law, we have to have our car auto insurance, and the stat, I believe it's 1 out of every 250, that have a major car accident, okay, but we have to have our auto insurance. Wouldn't live without it. It gives us the peace of mind. Same thing with our home. We have the peace of mind. If we have a fire, we have our homeowner's insurance, and yet 1 out of every 2.5, almost 3, will need some form of care in their life. Mm-hmm. And you're looking at that stat.
Those are staggering.
And that's here. It depends on what state you live in, but that's here in California. So
this is a it's a volatile issue, I would imagine, with a lot of people because of the financial commitment that has to be made.
Right.
And it sounds to me like it would also have to be a family decision, because sometimes what I've read is that families can come together and merge together and say, we'll pool in
Right.
to help get mom and dad long-term care insurance. So mom and dad,
Absolutely.
so you can create as a family unit. Everybody's pulling in. Now I do have a quick question. Can, say, Joe's married to Mary and Mary passes away and Joe lives, and can that insurance be transferred over to her? Him?
To him.
Yes, to the spouse.
Depends on the company, but that is available.
That
You
is
pay
okay.
that is what's called a rider. So that's an add-on to your plan, but that is
Okay.
available. The nice thing is with plans now, it's not only covering you wherever you are in the United States, okay? There's also worldwide, because we're traveling, we're living in other countries. We may not come back. We might be spending 6 months in another country and then come back here. And if something happens to you wherever in the world, you've got this protection.
That's a very valid point, because Medicare does not cover you anywhere outside of the U.S. And people don't realize that. Medi-Cal does not cover you outside of the U.S. So for your insurance for long-term care, as you're talking about, that's a very valuable resource, especially when you are looking at that.
And when you were mentioning about the children, that is one thing that the children, if they don't have the time to help out with their parents, as a team, as a family, they've decided to look into this. It's part of the discussion. And again, prior to you ever needing it, because it is your health that buys it, and also it's your age, because there's an age limit, again, depending on what kind of company, but that they will then protect their inheritance. So yes, if the average premium is about $2,300 a year.
Well, on
average.
that note, I have to say there is a lot that we can talk about, and we have flown through this conversation. I can't even believe it, and there's so much to learn. So I want to share with our audience to take your time and discuss with your financial planner or your insurance broker about looking into long-term care insurance, and discuss and find out if it is the right match for you and your family, both on an economic level and for you as an individual. Once again, thank you for joining us on Sandwich Crunch as we navigate the trends and issues helping seniors and boomers at home, in the workplace, and the community. Have a great day.